Hi, my name is Kimberly Ball, and this is my presentation on schizophrenia for Abnormal Psychology class 5013 at LeTu University. Schizophrenia is a severe mental disorder which wreaks havoc in people's lives. It literally can create chaos and turn their lives upside down when they are afflicted by it. The most striking thing about schizophrenia is that the patient loses touch with reality, and that's otherwise known as psychosis. The disorder is marked by both positive and negative symptoms. Positive symptoms doesn't mean that they're good necessarily. It means that they are in excess to what is considered normal behavior. So examples of positive symptoms would be delusions, hallucinations, abnormal motor behavior, and disorganized thought and speech. Starting with delusions. Delusions are false beliefs that people hold on to regardless of the evidence to the contrary. Such examples would be that the patient feels that someone is following him or her everywhere they go, so you could consider that a paranoid delusion. Sometimes they feel they're being persecuted, that they feel that the government is spying on them. They also may feel that they're someone famous, things like that. So this disease is marked by thoughts that are not correct in the sense that what they believe, and there is no convincing these people that what they believe is not true. So they firmly hold on to these truths, to them, these truths. The next is hallucinations, and hallucinations are people's false responses to stimuli that only they are experiencing. So it would be something that they see, smell, touch, taste, hear. Auditory actually are the most common within the disorder of schizophrenia, that people hear voices, especially in their heads, and often they will act out, either talking back or yelling back, regardless of where they are located, whether they may be on the bus or on the subway or walking on the street or in the library. And they just respond as if they are the voice people that are saying these things in their heads are really there. So hallucinations can be very disturbing for the people, their loved ones, and others around the people, because it seems these behaviors they have are very unpredictable, and you're not sure how these people are really going to act. The next symptom is disorganized speech, where people can make up words. Sometimes they have very loose associations and do not have logical trains of thought, and that's expressed in incoherency when they try to speak, and a whole rapid fire of garbled words. Word salad comes out, and they're incomprehensible to other people. So, and the last positive symptom I'm going to cover today would be abnormal motor behavior, where there's repetitious, often rapid movements, such as flailing the arms, kicking, things like that. Those would all be considered positive symptoms. So also abnormal motor behavior may be covered in the negative symptoms, which negative means that there are deficits in the behavior below what would be considered normal behavior. So, and in that sense, for the motor behavior, it would be catatonia. Catatonia is where people will often strike a pose, remaining rigid even when someone tries to move them. They will remain in that pose, and they'll stay that way for several hours or more, and often can seem very strange when you see someone just standing completely still in a strange posture. Other negative symptoms include the inability to experience pleasure, or the inability to find the words to say, aphasia, or logia, difficulty finding words to say. Apathy is another. They lack motivation, avolition, not caring anymore, not having a motivation to complete goals, to even set goals. So those are all negative symptoms. Another negative symptom would be flat affect, where people don't respond appropriately, that they don't have appropriate emotions. It may be on the side of hysterical, that they may laugh inappropriately at solemn occasions, or they may be just the opposite, where they have no response at all, no emotions demonstrated. And that often is linked to with speech, that sometimes they seem very hyper and rapid speech comes out, and yet other times, or it may be the norm, that they are without speech, so they are mute. So the DSM-5 sets these symptoms as the criteria for the disorder, that someone experiences these distinctive symptoms. There is no one single distinctive symptom for schizophrenia, neither is there a diagnostic test. It's all subjective and observation of behavior. But the DSM-5 sets that person experiences these symptoms for a 6-month period, with at least 1 month within that as active phase of the disorder, where a person would exhibit at least 2 of the following in that given time, which would be delusions, hallucinations, disorganized thought or speech, abnormal motor behavior, or negative symptoms. So that is the standard criteria for the diagnosis of schizophrenia. One of the other diagnostic criteria is that the person's life is affected, that they're no longer able to work, that they are unable to go to school, that they are unable to take care of themselves for that 6-month period, and that you see a general decline in their ability to function and to carry out normal life. So it can be extremely difficult to receive a diagnosis of schizophrenia. It can be hard on the family members. People often go through shock when they are first diagnosed, and if they are being diagnosed during a time where they're already suffering from loss or trauma or some other stress, then it can be an extremely difficult time in their lives. And we, as future counselors, need to be aware of this disorder and what we can do to help them. So schizophrenia started to be diagnosed, and not using that term, but seeing that there was a disorder in people, especially in motor movement, in the English asylums in the 1800s. And it was in the late 1800s, in 1896, that doctor put them all together as one rubric, one spectrum of disorders. And in 1911, it was given the name schizophrenia. And since that time, there has been much research done to try to define the symptoms and to try to clarify exactly what's going on. But at the same time, the disorder has kind of become a catch-all for anyone that's experiencing similar odd behaviors and traits. So it was in the 70s that neuroscience emerged and studying the brain, and it has been since found that there's a possible link to either biochemical imbalances, especially with dopamine, that people with schizophrenia tend to have more dopamine receptors than normal, but there are also other neurotransmitters that have been implicated in the disorder, such as GABA and serotonin. Also, they found that there are structural deficiencies or abnormalities in people with schizophrenia, such as smaller prefrontal lobes and temporal lobes, and also problems with the hippocampus and the amygdala and the thalamus. So there's a combination there. There seems to be a genetic connection, as identical twins show a 50% risk of developing schizophrenia, although then this draws into question why, if they have the same genes, do they not all suffer from the disorder? So instead, it seems that it's a diathesis-stress relationship, that there is a biological predisposition to schizophrenia, but it actually takes trauma or loss, extreme loss, or extreme stress to precipitate, to trigger the disorder of schizophrenia. It's not all completely understood. And to me, it seems the more we know, the more complicated it gets. Treatment of schizophrenia depends on the severity of the disorder, how extreme the symptoms are. It is important to treat schizophrenia as soon as possible following the first psychotic episode. This helps to preserve the patient's self-esteem and self-confidence and reduce the risk of suicide. The longer the schizophrenia goes untreated, the greater the risk that the delusions and hallucinations and associated behaviors may become entrenched and more resistant to treatment. Schizophrenia afflicts 1 in 100 people, and the financial cost of the disorder runs in the hundreds of billions of dollars, and the cost of human suffering to patients and loved ones is incalculable. So prompt treatment is essential to preserve patients' ability to function as much as possible. In times past, people diagnosed with schizophrenia would have a high likelihood of a future that would be fraught with disability from severe mental illness. Today, with prescription drugs and therapy, 20 to 30% of people fully recover. Yet up to 80% of people with schizophrenia will experience varying degrees of disability for the rest of their lives. Some will only have occasional psychotic episodes, and others will require constant daily care. Treatment focuses on the reduction of negative symptoms to help stabilize patients, and the first line of treatment is antipsychotic drugs. The first antipsychotic drugs were the conventional antipsychotic drugs developed in the 1950s. These drugs tend to cause Parkinson's-type symptoms with muscle tremors and rigidness and other side effects. But despite those side effects, these drugs represented a huge breakthrough in helping to reduce symptoms. In the 1990s, atypical antipsychotic drugs were produced. Due to the way they interact with the brain, they do not cause muscle problems, but they do have other side effects, some of which are very serious. The new atypical antipsychotic drugs help treat some patients for whom the conventional drugs had not worked. With the number of drugs available to patients, it can take time to find the right antipsychotic drug and the dose that works best for that particular patient with minimal side effects. Therapy is also an option for treatment, especially when coupled with antipsychotic drugs. The drugs help decrease the positive symptoms, so patients are able to gain better insight and understanding about the disorder, to recognize and challenge their delusions and hallucinations, and to develop coping skills and their ability to respond to stress. It is extremely important to find a doctor, a psychiatrist, and/or a therapist with whom the patient is comfortable working with. Therapy can help people with schizophrenia improve their social skills, as the disease strikes young people and often results in social isolation. Also, rehabilitative therapy may be needed to help resolve the concomitant substance abuse problem. Occupational therapy can help someone learn skills to help them to remain independent. And occupational therapy can be helpful to teach the patient skills to help them remain independent. Family therapy helps family members to understand what is happening to their loved one and what they can anticipate as far as future issues. Therapy teaches them new coping strategies and helps them to deal with stress. Cognitive therapy may be used to try to challenge distorted thinking or to recognize hallucinations in a more realistic light, to help counter the bizarre ideation associated with the disorder. Group therapy could also be of benefit, providing support in the shared experience and learning. Overall, education is a very important tool. Patients can learn what they are dealing with and what their options are for treatment. It can also promote hope, preparing patients for the psychological stresses caused by the disorder. Our case study is Archie, a 33-year-old young man who has some college education but never graduated. He is unemployed and transient. He spends most of his time wandering the city streets, where his at times incoherent speech is often directed at a wall, accompanied by rapid gesticulations with his arms. He suffers from delusions, believing that there is a gang of surfers who are trying to find him to beat him up, despite the fact that he lives in a landlocked Midwestern city. He will talk about his behavior, giving a different explanation each time. Sometimes it's brain damage, sometimes it's caused by being beat up, sometimes it's a lack of oxygen. Archie is well known at the local homeless shelters. People have tried to help him to be independent, setting him up with an apartment, but he's unable to remain in such situations for more than a couple of weeks before he is on the streets again, sometimes disappearing for a period of time after leaving the apartment. It is unknown whether Archie also has a substance abuse problem as well. He is infrequently lucid, yet when he is capable of higher-level math and physics, and he desires to share his knowledge with people he feels he can trust. Archie has suffered from schizophrenia for at least 10 years. From the various stories he has related, all taken together, seem to point to his beginning to have trouble around the age of 22. Due to this extended period, it is imperative to get him started on an antipsychotic drug regimen to decrease his hallucinations, especially his auditory hallucinations. It may take some trial and error to find the right one for Archie, with the minimum of side effects.
The drugs would probably show an improvement in Archie's behavior and thoughts in a week or so, but it may take up to 3 months to see greater stability overall. Archie is intellectually curious during his periods of lucidity, and a reduction in positive symptoms may benefit him in allowing him to learn more about his disorder and the effects it is having on him. Therapy would help him to learn what is happening and how to better cope with the stress. Occupational therapy may also be of benefit to teach him how to live on his own, off the streets, as he seems to struggle and is unable to maintain life in an apartment. It is a concern that his schizophrenia has been full-blown for 10 years without treatment, so it may be difficult to reduce his symptoms. His delusions may be firmly entrenched, and it may be difficult to eradicate them. Another complication is the fact that Archie is homeless. He does not carry any possessions with him, only an occasional book, which he often misplaces. So it may be difficult to ensure that he is taking his medication regularly. He is amenable to going to hospitals when he needs care for various ailments, so it may be possible to establish an outpatient care routine to ensure he's going to therapy and getting his medication. Perhaps once he can see the benefit of his medication, he would be willing to continue it on his own. Another complication is that although the medication would start in the first week, it could take up to 3 months to be fully effective, and it is a concern that Archie may travel a lot before a doctor or therapist could follow up with the effects of the medication. Another complication is that Archie is already very restless. He's a very active individual, and as certain antipsychotic medications actually aggravate restlessness, might aggravate his condition. Another concern is that it's possible that Archie does have a substance abuse problem, so rehabilitative therapy would need to be sought if that were in fact true. Prognosis. Overall, if Archie could be sure to take his medicine on a daily basis, I believe the prognosis would be fairly good and would definitely reduce some of the symptoms of schizophrenia, which would help him to be more capable of social interaction. When he's lucid, he's already quite gregarious, so to be able to decrease some of his symptoms would be beneficial to him and his social condition. It also remains to be seen how he tolerates the antipsychotic drugs and what adjustments need to be made to find just the right drug and dosage for him with a minimal number of side effects. Without any treatment, it is very unlikely that Archie will recover on his own. Archie often complains he's already an occasional victim of crime and violence, so it would be much better for him to receive treatment which would prevent him from being in situations where he's at risk. Schizophrenia creates huge obstacles for people. It places barriers between them and the rest of society. Treatment increases stability and enables patients to have greater social interaction. Thank you.